If you're a teenager dealing with acne, your parents probably told you it's just a phase and you'll grow out of it. But here's what they didn't tell you. The skincare mistakes you're making right now could leave permanent scars and damage that will follow you into your 20s and beyond. I'm Dr. Mara Weinstein, a board-certified dermatologist, and I treat teenagers every single day in my practice. And let me tell you something, teen acne is not just a phase you have to suffer through. There are specific science-backed strategies that can clear your skin and prevent scarring. But here's the problem.
90% of the skincare advice on TikTok and Instagram is not only wrong, it's actually making your skin worse.
Today, I'm giving you the real dermatologist playbook for clear, healthy
teenager skin.
Why teen skin is different. Before we dive into the routine, you need to understand why your skin is acting crazy right now. It's not your fault, and it's not because you're dirty or eating too much chocolate. The teenage skin storm. Hormones increase oil production by up to 500% during puberty. Your pores are literally getting clogged faster than you can clean them. Testosterone, yes, girls have it too, triggers more sebum production. Your skin cell turnover is actually slower than adult skin. I had a 14-year-old patient, Emma, whose mom brought her in crying because kids at school were calling her pizza face. Emma was washing her face 4 times a day with harsh scrubs, thinking she could scrub away the acne. Her skin was red, inflamed, and breaking out worse than ever. Here's what I told Emma and what I'm telling you. Your acne is not a hygiene problem. It's a medical condition that requires the right treatment. What's really happening? Your sebaceous glands are working overtime. Dead skin cells are sticking together instead of shedding normally. Bacteria, specifically C. acnes, are feeding on the excess oil. This creates inflammation, which leads to red, painful breakouts. Now here's the good news. Teen skin is incredibly resilient and responds amazingly well to the right treatment. I've seen severe acne clear up in about 12 to 16 weeks with the right approach. But you have to be patient and consistent. Let me tell you about the 5 mistakes I see every single day that are sabotaging your skin. Mistake number 1, the overwashing obsession. I see teenagers washing their face 3 to 4 times a day thinking more is better. You're stripping your skin's natural oil barrier, causing it to produce more oil to compensate. Jake, a 16-year-old wrestler, was washing his face after every practice with antibacterial soap. Now, I commend him for his skincare practices, but his skin was so irritated and oily that he looked like he'd been dunked in grease. We cut back to twice a day with a gentle cleanser, and his skin improved dramatically. Mistake number 2, DIY disasters from social media. Lemon juice, baking soda, toothpaste on pimples, I've seen it all. These hacks can cause chemical burns and permanent scarring. Mistake number 3, picking and popping. Now, I know it's tempting, but every time you pick at your skin, you're pushing bacteria deeper and creating inflammation that can lead to permanent scarring. Mistake number 4, using adult acne products too soon. Your skin is different from your mom's skin. Those anti-aging products with high concentrations of retinol and acids can destroy your skin barrier. Mistake number 5, expecting overnight results. Skincare is not magic. It takes 12 to 16 weeks or about 3 to 4 months to see real improvement. Most teens give up after 2 weeks because they don't see instant results. I get it. You want clear skin for prom or school pictures or for that date, but your skin cells take 28 days to even turn over. So any product that promises overnight results is lying to you. This is the exact routine I give to my teenage patients, and it works for 85% of them when followed consistently. In the morning, step 1, use a gentle cleanser. Massage for about 30 seconds and rinse with lukewarm water. My favorites for teens are the CeraVe Foaming Facial Cleanser, Neutrogena Ultra Gentle Daily Cleanser, and obviously the Sincerely Yours Kindly Clean Cleanser. Never use bar soap, antibacterial soap, or anything that makes your skin feel squeaky clean, because that just means that the skin barrier has been completely stripped. Why gentle matters. So your skin is already inflamed from acne. Harsh cleansers and more inflammation can trigger more oil production. Step 2, the treatment. Start with 1 active ingredient. For beginners, salicylic acid. Start with 0.5% concentration and use it every other day for the first 2 weeks. My favorites, CeraVe SA Cleanser and Paula's Choice Calm BHA. For established routines, start with benzoyl peroxide. 2.5% is just enough, not 10%. That's way too harsh, and typically reserve 10% for the back and chest, for the body. Apply to the affected areas only. Some of my favorites, Panoxyl 4% benzoyl peroxide or Neutrogena on the spot, which is going to be more of a spot treatment. Step 3, moisturizer. Yes, even oily skin needs moisturizer. Skipping this step makes your skin produce more oil. Look for non-comedogenic on the label. Lightweight gel-based formulas work best. Some of my favorites are Neutrogena Oil-Free Moisture Gel, Neutrogena Hydro Boost Water Cream, CeraVe PM Facial Moisturizing Lotion, and of course, Sincerely Yours So Soft Daily Facial Moisturizer. Step 4, SPF. This is non-negotiable. Acne treatments make your skin more sensitive to sun damage. SPF 30 is the minimum. It should be used every single day, and mineral sunscreens are gentler for acne-prone skin. My favorites, Elta MD UV Clear and Blue Lizard Sensitive Face, and Sincerely Yours Sunny Side Up mineral-based sunscreen. Let's talk about the evening routine. So step 1, you're going to use the same gentle cleanser. If you wore makeup or heavy SPF, double cleanse with micellar water first. Step 2, you're going to use your treatment. So on alternate nights, Monday, Wednesday, Friday, use your morning active salicylic acid or benzoyl peroxide. On Tuesday and Thursday, those are going to be your recovery nights, so just use a cleanser and a moisturizer. On the weekends, add a gentle treatment if the skin is tolerating the routine well. Step 3, the same moisturizer that you did in the morning. Your skin repairs itself at night, so moisture is crucial. And remember, if the seasons have changed and you need something a little bit heavier, make sure that it's non-comedogenic, but it's still a cream-based moisturizer that you can use for your evening routine. Now let's talk about the patient's protocol. Weeks 1 to 2, your skin might get worse before it gets better. So this is the normal process of purging. Weeks 4 to 6, you should start seeing small improvements. Week 8 to 12, you should start noticing significant improvements in breakouts. And weeks 12 to 16, clear, healthy skin. Now, budget breakdown. It's important to talk about budget and what exactly you should expect to spend. This entire routine costs about under $50 and will last 3 to 4 months. A cleanser should fall between $8 to $12, the treatment about $6 to $15, moisturizer $8 to $15, and SPF is going to be a little bit pricier, $10 to $20. Now let's talk about dealing with different types of acne. Not all acne is the same, and your treatment should match your specific type of breakouts. So if you get whiteheads and blackheads, this is under the category of comedonal acne. These are essentially clogged pores, not infections. Salicylic acid is your best friend for this type of acne. It delivers anti-inflammatory benefits and it dissolves sebum or that oil production that's clogging up your pores. Be patient, it does take 6 to 8 weeks to see improvement, and again, never squeeze your blackheads. You'll just make them bigger and harder to get rid of. If you have red inflamed pimples, this is called inflammatory acne. Now these are infected inflamed pores, and benzoyl peroxide kills the bacteria that's causing the inflammation. Ice can help reduce swelling in a pinch, but it's not going to be a long-term treatment. I love hydrocolloid patches. They can really help clear whiteheads safely, and they also encourage you not to pick. Now, if you're developing deep, painful cysts, these might require professional treatment, so don't try to treat those at home. See a dermatologist ASAP to prevent scarring, and never ever try to pop or squeeze cystic acne. We have such great prescriptions that work quickly and can be very effective. Now, hormonal acne tends to present itself along the jawline and chin, or we call this the beard distribution in a male. Easy to remember. It's more common in teenage girls, and it often gets worse around your period. It may require an intervention like a birth control pill or some sort of hormonal treatment. So in this case, you might need to seek help from your OBGYN or dermatologist, and a consistent skincare routine is still essential. Now let's talk about Marcus. Marcus was a 15-year-old with severe acne who came in after trying every single drugstore product. His skin was so inflamed he didn't want to go to school. In fact, he wore a mask in public spaces to conceal his acne. We started him on a prescription retinoid and antibiotic combined with a gentle skincare routine, and in just 4 months, his skin was completely clear. He went from hiding in hoodies to joining the debate team. So when should you see a dermatologist? If you have cystic acne that's painful, acne that's not improving after 12 weeks of consistent over-the-counter treatment, any scarring you're noticing from breakouts, and acne that's affecting your mental health or self-esteem. Now, we can't talk about acne without delving into some of the lifestyle factors that actually matter. Skincare products are only part of the equation. These lifestyle factors can make or break your clear skin journey. The diet debate. So here's the truth about food and acne. Dairy and high glycemic foods like white bread and sugary snacks can worsen acne in some people. Now, it's not the same for everyone. Some teens can eat pizza daily with perfect skin, but keep a food diary if you suspect that certain foods are triggering your breakouts. Don't eliminate entire food groups without talking to your doctor. So I had a patient, Sarah, who noticed her skin got worse every time she had a milkshake. We had her eliminate dairy for 6 weeks and her skin improved significantly, but her twin sister could drink milk all day with no skin issues. So clearly it's not the same with everyone, and their skin doesn't respond the same with everyone. Skincare is so individualized, and that's why it's so important for you to keep a log of when you break out, and this can be really helpful for your own education and when you come in to see your dermatologist. Now let's talk about sleep and stress. You all know it, lack of sleep increases cortisol, which triggers more oil production. Aim for about 8 to 9 hours of sleep per night. So stress doesn't directly cause acne, but it makes existing acne worse. And of course, if you're tired, your threshold for becoming stressed is even lower. So try to find some healthy stress outlets like exercise, music, art, whatever works for you. And now a topic I get asked about all the time, the phone and pillowcase factor. Your phone screen is covered in bacteria. Make sure you wipe your phone screen every day with alcohol wipes. Change your pillowcase 2 to 3 times a week. If you have long hair, keep it off your face while sleeping. Wash your makeup brushes weekly, and please don't touch your face in the middle of the day. If you need to touch your face or you have an itch, it's best to use the backs of your hands, which are less likely contaminated with bacteria. Exercise and acne. Exercise is great for overall health and stress reduction, but sweating sitting on your skin can clog your pores. So make sure you shower immediately after working out. And if you can't shower right away, use gentle cleansing wipes or micellar water. Or even just splash your face with some fresh water in the sink after you work out. The makeup question. Yes, you can wear makeup with acne, but just choose non-comedogenic products and remove your makeup completely every night. Make sure you clean your brushes and sponges regularly. My favorite teen-friendly makeup is Neutrogena and CeraVe. They make great tinted moisturizers, as well as La Roche-Posay. Now, there are some supplements that might help reduce acne breakouts, like zinc. Zinc supplements have been shown to reduce inflammation, but make sure you talk to your doctor first, because if you just take zinc without any medical advice, it can cause some stomach upset and might be more harmful than helpful. Omega-3 fatty acids may also help with inflammatory acne, as well as probiotics, which are currently being studied for their effect on skin. But never replace a good skincare routine with supplements alone. Now let's talk about preventing acne scars. So this is the most important section for teenagers because preventing scars is so much easier than treating them later. Acne scars form when you pick at your skin when cystic acne damages your deeper skin layers due to inflammation. Once you have scars, they're permanent without professional treatment. So preventing scars should be your #1 priority. I see so many patients in the office that come in after the fact who have had acne, not treated by a dermatologist, and now they've noticed the scarring that's ensued. I know it's hard, but picking at your skin is the fastest way to create permanent scars. Here are some strategies to stop picking. So first off, keep your nails super short. This will prevent you from getting in there with your nails, which are also probably contaminated with some bacteria. So really, it's a double insult to the skin. Use hydrocolloid patches on whiteheads instead of popping them. If I didn't say it already, I'm saying it again. Keep your hands busy with a stress ball or fidget toy to keep you from picking at your skin. And if you really need to, put sticky notes on your mirror reminding you not to pick. Now, there are really no safe extraction methods. When my patients come into the office, we can do a session of extractions, and usually we combine that with chemical peels. But again, use acne patches or hydrocolloid patches for whiteheads. You can apply ice to reduce inflammation, and make sure, like I said, you see a professional if extractions are needed. Just like with everything, with screening and skin cancer and acne, early intervention is key. Start your treatment intervention as soon as your acne appears, and go ahead and reference this video as a guide to know where to start. Don't wait for it to get worse before seeking help. And consistent treatment prevents deep inflammation that leads to developing those acne scars. Red or dark marks after breakouts usually fade within 3 to 6 months, but true scars don't fade on their own. When you are experiencing active acne, it's really important to wear sunscreen every day, because if you have anything red on the skin or active breakouts or something that you popped, it can lead to scarring if exposed to UV. True scars are indented or raised, like hypertrophic or keloidal, and they don't fade on their own. Sunscreen helps the red marks fade faster, and vitamin C serums can help with that post-inflammatory hyperpigmentation. If you already have acne scars, don't be distraught. We have some amazing treatments like chemical peels for surface or superficial scarring, microneedling for some deeper scars, and laser treatments for severe acne and deeper scars as well. The earlier you treat the scars, the better the results. So here's what I want every teenager to remember. Clear skin is not just about luck or genetics. It's about consistency, patience, and using the right products for your skin. Your teenage years are hard enough without having to worry about your skin. But with the right routine and realistic expectations, you can have clear, healthy skin that boosts your confidence instead of destroying it. The most important thing, start now. Don't wait until your acne gets worse. Don't suffer in silence because someone told you it's just a phase. You deserve to feel confident in your own skin. Are you a teenager struggling with acne, or are you a parent trying to help a teen? Drop a comment and tell me your biggest skincare challenge. I read every single comment and I'll help you create a personalized plan. And if this video helped you, hit that subscribe button because I'm sharing more teen-focused skincare content every week. Your clear skin journey starts today.